First, I'd like to start with the extension principle with patient-generated forces. And the first movement that you're going to do in the extension principle is retraction, which is the initial ranges of extension. So I like to use a lumbar support roll and correct the patient's posture. In a chair, if you don't have access to a nice chair with a straight back, to use a lumbar support roll, and you can have your patient seated on the plinth as well. You just want to make sure you have them in a nice upright position. So basically for just retraction, you're going to have them draw their chin into their spine and then release. So hold for about a second, retract, hold, and release. Okay, so that's just retraction. I'll show you what that looks like from the side. Okay. Retraction. Okay, so that is your retraction movement. Then you can have the patient add overpressure to that. So again, seated with good posture, you can have the patient retract, and then they're going to add a little bit of overpressure with their fingertips. I sometimes will have them take 2 fingers and push straight back. If they're not going to use 2 hands, be careful. Sometimes they tend to deviate while they're retracting if they're just using one side. So using both hands helps them stay very symmetrical. And the goal with both of these, whether they're adding overpressure or not, is to make sure their head stays level, stays horizontal, and it doesn't deviate down or up during the movement. So the head should stay very level here. And that's your retraction.